Greetings from Citizen Health and the Team Academy IAPA Semi Connect. And today, in the series of People's Health It Matters, we have Dr. Prachet R, who is Associate Professor in Department of Epidemiology, Center for Public Health, NIMHANS, Bengaluru. A very warm welcome to you, sir, on behalf of all the audience.
थैंक यू वेरी मच नमस्ते
नमस्ते सर और आज हम बात करेंगे वी विल टॉक अबाउट फर्स्ट एड एंड प्लीज सर टेल मी दैट व्हाट इज फर्स्ट एड
yeah first aid is the help that we can provide to somebody who's stuck in an emergency or injured before the actual professional medical help arrives.
Okay, so what is the need of learning it? That why one must learn about the first aid?
Yes, first aid is extremely important for every person. Okay, because in an emergency like situation, the first few minutes are considered to be the golden minutes, critical, very critical. So if we administer first aid properly, if we know what to do, what not to do, we'll be able to save lives, we'll be able to become heroes. Not just the doctors and nurses, every individual can become a hero if he or she knows how to administer first aid. Plus, there are many opportunities for people to volunteer their skills. We have organizations like Red Cross where people can get training and certified training and also administer first aid in emergency like situations. Therefore, first aid is a very important life skill.
Okay, sir, so what are the aims of first aid?
There are many aims of first aid. Firstly, we need to save lives, preserve the life, protect life. That is number one. Secondly, we need to prevent further damage. We don't want the situation of that person to deteriorate further. Thirdly, we need to ensure that there is healing, there is recovery. So that's another aim of first aid.
Okay, so whenever we try to learn anything, there must be a rule. So, what is the rule of first aid?
Yes, there are many rules of first aid. There are many do's and don'ts. It's important to know what we are not supposed to do and what we are supposed to do. I'll tell you first what we are supposed to do. We need to have eye contact. We need to have an eye contact with the person. We need to talk to the person, reassure him, if possible, touch the person whenever required. Do not hesitate to touch the person. Finally, it's very, very important to call for emergency help. Call the ambulance at the initial stage itself. We need to accept that we are not supermen here. We will not be able to save the person, but we can be agents through which the person may recover and we may be able to contribute towards saving their life. So it's very, very important to call for help at the initial stage itself and always assess the danger. So if the situation is too dangerous, suppose there's a hazard there, there's fire, we should not jump in. We must ensure that we are safe first. Our safety is of utmost importance, because if we get stuck, then we'll have to call a third person for the help. So that's another basic rule of first aid.
Okay, so when there is emergency, how to call for the emergency help? Just to call ambulance, or is there any other way to call for the help?
Yes, we need to call the ambulance. We must be knowing the ambulance number. Of course, nowadays, all our smartphones, when I go to my contacts, I'll be able to easily find my ambulance number, which is 102. Of course, many states have their own numbers. In Karnataka, I belong to Karnataka, we have 108 ambulance. So it's very important to know the ambulance number, dial the correct number, and give them accurate information. Suppose there is an accident in a highway and people are injured there. So once we call the ambulance, we need to tell them the accurate location, the precise location, the landmark. We need to also tell the ambulance people how many of them were injured, how many children were there, how many elderly people were there, how many men, how many women, what kind of injuries are they having, what is the nature of the injuries, how many are unconscious, how many are having minor injuries. It's important that we tell them all this so that the ambulance people are well prepared. They know what to do, they know what to expect. And finally, very, very important, We should also inform the ambulance people if there are any hazards in the site. If there's any fire or any other hazard, we must inform the ambulance personnel. So these are the rules that one must follow while calling for emergency help.
And don'ts?
So don'ts, like I said earlier, many a times they do not give accurate information. So when they call for help, maybe the people themselves are panicked. They're very anxious. They do not give accurate information. So that way, what happens? The ambulance people are also in a difficulty. They'll not be mentally prepared. So that's one thing that we should avoid. So we should give clear information, okay, and most importantly, never jump in when there is a danger already. Assess the situation first. If it's too dangerous, please stay back and wait for the emergency services to arrive and give the appropriate help to the people.
Okay, so there are many situations in which we need first aid, but what to do? What will be the first aid for the unconscious people? If the people get
Yes.
unconscious, then what to do?
So unconsciousness, we might encounter this in our daily life. So it's important for us to know what exactly needs to be done when a person is unconscious. So we need to remember four letters of the English alphabet: DRAB, DRAB. D stands for danger. So we need to check dangers to ourselves as well as other people. If it's too dangerous, like I said, I'm repeating this again, we need to stay back. So make the scene as safe as possible. Remember that you are the most important person here. If the area is too dangerous, stay back and then call for help. We need to follow the protocol, what I told earlier, and call for help. The second letter, R, stands for response. So we need to attempt to wake the person by shouting loudly in both the ears. If we know the name, shout the name. Tap them on the shoulders. If there's no response after this, that means the person is unconscious. So, what happens in an unconscious person? An unconscious person loses control over his stomach muscles, and the contents that are there, the food particles that are there in the stomach, may go up to the throat and block the airway. So, when the airway gets blocked, breathing becomes very difficult. Do not worry, all we need to do is open the airway. So the question is how to open the airway. So now I'm coming to A, which stands for airway. So you can see the picture here, there's a blocked airway and there's an open airway. So we need to hold the forehead of the person in one hand, and in the other hand, gently lift the chin up. And that's how we open the airway. Then comes B. B here stands for breathing. So we need to assess whether the person is breathing properly. So all we need to do here is keep the hand on the person's head and on the chin, and then place your cheek above the mouth of that person and look at the chest of that person. Look at the chest, look, listen and feel for any regular breathing for around 10 seconds. Assess normal breathing. Just look and listen whether that person is breathing or not. So if we are in close contact, we'll be able to do that. We'll be able to assess whether the person is breathing properly or not. So suppose he's gasping or he's snoring, that is not normal breathing. So that's something we should be aware of. So that is DRAB. Then what next? We need to call the ambulance. That has to be done as early as possible. If it's not done, call the ambulance. Recheck the breathing once again. Once we have checked for 10 seconds, we are not finding any evidence of breathing. Recheck the breathing again. So if he's not breathing even after this, then we need to do something called chest compressions. We need to give chest compressions. How to give chest compressions? So we need to kneel next to the person's chest. That's how the person giving chest compressions has to be positioned, as seen in the picture. Lock the elbows together. Lock the elbows together and position the shoulders above the person's chest as seen in the picture, and then use the entire upper body. The hand has to be placed on the center of the person's chest. We call it as the breastbone or sternum. So we need to place our hands on the center of the person's chest or the breastbone or sternum, and then give chest compressions. So we need to give chest compressions. It should be a very good effort, very good quality. 100 to 120 compressions have to be given per minute. So it should be quick. At the same time, it should be of good strength and quality. So after every 30 chest compressions, we need to give something called rescue breaths, mouth-to-mouth resuscitation. So this may or may not be done. Even if it's difficult to do this, we must give the chest compressions, at least 100 to 120 chest compressions per minute. So how to give the rescue breaths? So tilt the person's head backwards first, as seen in the picture, and make a seal over the mouth and blow the air for 1 second. So this is optional. If it's difficult to do this, we can avoid this, but we must give the chest compressions in an unconscious person. So then, when do we stop these chest compressions? When the person shows signs of life like coughing, breathing, etc., we can stop it. That means whatever treatment we give, whatever first aid we give has been effective. Or if a healthcare professional, suppose the ambulance personnel arrive, okay, and they have asked us to stop it, we can stop it. If we are too exhausted, we can stop it, but there has to be another person to take over. So ideally, a person who's giving chest compressions has to carry this out for 2 minutes, and then another person has to take over, because after 2 minutes, obviously we get exhausted, we get tired. So that we are fresh, another person has to take over. Therefore, many people need to be trained on first aid. It's not important if only one person, if you or if I get trained. We need to ensure that even our friends, our peers, our batchmates, anybody, our family members, all have to be knowing about basic first aid. So that's about first aid in case of an unconscious person.
It was really informative information, sir. And one more thing I want to know, that what first aid can be used in case of burn?
Yes, burn injuries, again, we might encounter it in our daily life. So we must remember that there are different types of burns. So there are different types of burns. We have first degree burn, second degree burn, and also we have third degree burn. Okay, so our approach depends on the degree of the burn. So first degree burn means only the outer layer of the skin is burnt. So it's not that severe. It might happen even in the kitchen while handling a hot item or a hot cooked food item, or so it's only the outer layer of the skin. So it's very external, superficial. So that's first degree burn. Then we have second degree burn, where it's comparatively much severe when you compare it to the first degree burn. So here the first and second layer of the skin both are burnt here. So for first and second degree burns, the first aid is very simple. So all we need to do here is cool that particular burn or the wound with running water. Okay, place it under the tap. Okay, and then switch on the tap. Place it for 10 minutes. So cool that burn area for 10 minutes. Okay, then you may cover the burnt area with a bandage or a gauze or a clean sheet, and monitor for any increased pain or redness or swelling. And then you may, if possible, you may take the person to the hospital for further care. So this is in case of first and second degree burns. So here, like I said earlier, it's important to know the don'ts. Okay, never use ice in case of burns. This is one mistake people do. Never try to break the blisters, so they'll be having wound or blisters, right? People try to break it. Never break it. That would lead to infection. That would lead to further damage. Do not start before your own safety. That's a golden rule of first aid, even in case of burns. So this is first and second degree burn. What about third degree burn? So here all layers of the skin are affected. There's a lot of damage, not just the skin. the fat, muscle, bone, everything gets damaged. So this is an emergency situation. So we need to call for help at the earliest. We need to do that emergency call, tell the ambulance personnel, okay, or if possible even the fire engine, tell them the location, how many are injured, what kind of injuries are there, how many children are there, how many elderly people are there, is there any other hazard over there, give them the accurate precise information. Okay. And then we need to check for airway, breathing, circulation. So the same protocol that I told in case of an unconscious person, DRAB, that is danger, response, airway, breathing, circulation, all that has to be carried out. Never immerse it in water now. So in first and second degree burns, we said that we need to cool the burnt area with running water or tap water. That should not be done here, because what happens is suddenly the temperature may reduce and it may lead to a condition called shock, which could be life threatening. So never immerse the burnt area in water. Elevate the part. That means, the burnt area has to be kept up. We need to elevate it. Okay. And if possible, cover the area with bandage and take him to the hospital at the earliest. So here, in any emergency like situation, so it's better if many people are there. So one person can call for help, the other person can do the first aid. So we need to take turns. It's a teamwork at the end of the day. Okay. So suppose there's a major fire as seen in the picture. So we need to instruct the person to first stop. Okay, when they are running, they should stop, then drop as seen in the picture, and roll, then roll. Okay, and cover the person maybe with a blanket. So stop, drop, cover, and roll. So cover the person with a blanket. Move away from the source of fire. Always move away from the source of fire and call for help. So this is an emergency situation. We need to call the fire engine as well as the ambulance. So when there's a major fire, we should call the fire engine. So 101 is the number for the fire engine. So we need to remember here that in any first aid, it's a teamwork at the end of the day. So it's better if more people are aware, more people are a part of the team, more people are trained.
Totally agree, sir. Totally agree. Thank you so much for such an informative session. I hope this will help many of us. Thank you so much for this beautiful session, sir.
Thank you so much.